My name is Amanda and I'm a CCA in long-term care. And the reason I went into this field is because my mom had cancer and she actually passed away from it, and my son had leukemia for 4 years. And being in the hospital environment, you see that the difference that is made, even if it's a small difference in your daily battle of what you're dealing with. So I kind of wanted to be part of that difference. I was given so much to me in my life, that difference, that I wanted to give back a little bit. So I jumped into long-term care, and at first, it was very heartbreaking to see what people had to give up because they had a healthcare issue. Because when you're perfectly healthy, you don't have to give anything up. And the moment that you have something that stops your daily routine or your daily life, or you need that help, there's certain things that you have to give up, which you shouldn't have to. I went from Saskatchewan to a rural community. I enjoy knowing that I can help somebody help plant a garden in a day, or just have a shower, or the ability to visit with family, and knowing that when you're at work and you get them up in the morning or put them to bed at night or do whatever, that they still have that ability to be normal, and it's their normal. To be able to help them through a tough moment that they have. I think the hardest part of my job is not being able to fix it, but I can help them get through the problem. My greatest blessing every day is seeing the smiles on these people's faces, that if it weren't for our assistance in activities of daily living or just their daily life, that they wouldn't be in their chair having coffee with their daughter or son, or they wouldn't be able to have a manicure and their hair washed, and maybe not be able to sit at a table and eat like you or I would. So I think for me, the most important part of my job is knowing that if we can just make a little bit of a difference, I think it goes a long way to these people in long-term care. In rural, you all become a family. Joe's grandma becomes your grandma, and you watch the grandkids grow, and all of a sudden they're graduating, and you're like, holy, it's really different, but it's great to watch how people are with their family. And it's nice to see the difference everybody makes, whether it's a CCA, whether it's an LPN, whether it's food services, whether it's activities. We all make their day a little bit easier. Everybody has to work together as a team. Okay. Because bath time, there's people who have wounds, there's people who need medical care after their baths or previous to their baths, so everybody kind of has to work as a whole in order to get the day done, including the residents. And sometimes for them, it can be really tiring on them. Starting your day at necessarily 7:30 in the morning, by 1 o'clock in the afternoon when you're 108 years old, that's a long day. But we hope that they're smiling at 1 o'clock in the afternoon, because we've tried our best to make their days as easy and good as possible.
I'm Neil Coleman, Vice President of SEIU West. These videos feature the range of professional skills offered by our members daily. They are essential to public healthcare teams. But every day they are challenged by privatization, cuts, and short staffing. Together, let's send a message to the government. Stop dismantling our healthcare. United by one union, SEIU West, and one color purple, we ask, please share this video and visit our action page. Thank you.